Hello and welcome to a very special webinar dedicated to the incredible global work of the Fred Hollows Foundation, Restoring Sight, the Social and Economic Impacts. My name is Sally Mousa and I'm your host for today's session. I'd like to start off by thanking the Australian Business Group in Abu Dhabi and Australian Business Council in Dubai for their support as partners in hosting this session. We are going to be having a live Q&A, so we do invite you to share your questions here through the chat box on the side of your screen. And questions are going to be answered at the end of the session. And now, introducing Professor Fred Hollows.
What did he say?
He says you can see quite well.
The thing that characterizes human beings is that human beings know about charity. They know about looking after the halt, the lame and the blind.
As a little girl growing up in Australia, I remember hearing about the legendary Dr. Fred Hollows, a man of extraordinary character and vision, whose namesake foundation has now helped more than 2.5 million people around the world to see and counting. The indomitable Frederick Cossum Hollows was an internationally renowned eye surgeon and humanitarian who began working in the early 1970s with Aboriginal communities across Australia. This work revealed to Fred the shocking standard of healthcare available to them, particularly concerning eye health. He was especially disturbed by the huge number of adults and children suffering from blind trachoma, a disease rarely seen in other parts of Australia. These experiences drove Fred on a lifetime mission to fight for better access to eye health in vulnerable communities all over the world. Dr. Fred Hollows died in 1993, but not before transforming more than 1 million lives through his work. And through the Fred Hollows Foundation, millions more are discovering the priceless gift of sight. Today, I'm honored to be joined by Alison Hill, Director of Global Communications and Branding for the Fred Hollows Foundation, who's going to be giving us insight into the foundation's work, the costs and benefits of investing in vision, why blindness impacts women more than men, and how restoring sight is vital to achieving gender equity. Alison, welcome.
Thank you, Sally. It's wonderful to be with all of you in Dubai. I'm sad I can't be there in person, obviously. I've been fortunate enough to visit our office in Dubai a few times over the years, and I wish everyone well, and I thank you for joining us this afternoon.
So great to have you. Now, as we begin this, the man whose name the foundation carries today was truly incredible. A lot of us who grew up in Australia, of course, we had heard of Fred Hollows, Professor Fred Hollows, but I don't think a lot of us really truly appreciate the impact that his work has had on millions of lives worldwide. So where did this journey start and how did it spread across the world?
Fred was a great humanitarian and a great eye surgeon, and he used to say that the greatest attribute of mankind was that we would look after each other, and that's really the heart of what the foundation does. Fred's work started really in the 1970s when he saw the massive disparity that existed at the time between Aboriginal people and the rest of Australia in their eye health. Aboriginal people were 10 times more likely to be blind than other Australians, and that passion was something that really started with Fred and that continues with the foundation today. And I want to acknowledge that I am on the land of the Gadigal people of the Eora Nation here in Sydney, and to pay my respects to the elders past and present, and to acknowledge that this is, was and always will be Aboriginal land, and that's something that's really at the heart of the Foundation's work. From there, Fred led a program around Australia to restore sight to Aboriginal people from that disease, trachoma, that you mentioned earlier. And they actually halved the rate of blindness in Aboriginal communities during the 1970s off the back of that program. He then was asked by the World Health Organization to have a look at trachoma in other parts of the world, and he was lucky enough to visit places like Nepal, Eritrea, Sri Lanka, Vietnam, and he discovered that not only was trachoma a massive problem, but that cataract, which is the leading cause of blindness still to this day around the world, was a major problem, and that people in developing countries just did not have the same access to eyesight as people in developed countries. And he thought that that was incredibly unfair. And so he set about working with others to try and improve that. And the biggest barriers he saw were the fact that surgeons were not trained to do modern cataract surgery because it was believed they didn't have the skills to do that surgery, and the cost, because the tiny little intraocular lenses that are placed in your eye when you have the cataract removed cost about $150 at the time. And of course, if you're someone in a developing country living on less than $1 a day, a surgery where the little lens costs $150 is well out of your reach. And so his idea was that we should do something to make that surgery more affordable. And that's how he came up with the idea to build factories to make those lenses in places like Nepal and Eritrea. And that really transformed eye health, and it reduced the cost of those tiny lenses from about $150 to $5. And so that all of a sudden meant that that surgery was affordable and available to millions of people. And those two factories that were set up, they didn't actually open until after Fred passed away in 1993 and 1994. But they're still operating today and have now produced more than 7.5 million of those lenses that are used in surgeries right around the world.
You know, it's pretty incredible when we think about global blindness. There's an estimated 36 million people in the world who are blind, but actually most of them don't need to be. This is staggering.
Yeah, I think that people, when you tell them that 4 out of 5 people who are blind don't need to be, I know when I started at the foundation and I heard that statistic, I thought it couldn't possibly be right, because why don't we just fix it then? Particularly when you think about something like cataract, it's a really affordable surgery. We in Australia talk about it being 25 Australian dollars, which depending on your exchange rate is about 65 to 75 dirham to restore someone's sight in many countries where we work. And so, you know, the foundation is focused not only on delivering those surgeries, but the most important thing to us is that we ensure we're empowering local people to deliver the services. So it's not about flying Australians or Emiratis or Americans into a developing country and having them do the surgeries and then flying home. It's about training surgeons in Bangladesh and Pakistan and Afghanistan and all of the different countries of the world where we work, so that they know how to deliver the surgeries and that they can continue to deliver the surgeries, and that we've built up the health system so that hopefully one day we do ourselves out of a job, they don't need us anymore and could deliver their own services.
Let's talk about the different kinds of blindness and, you know, why avoidable blindness exists, you know, in so many different communities and those groups who are vulnerable, who are poorer around the world. So take us through the different kinds of blindness that we're looking at here that the foundation addresses.
Yeah. As I said, cataract is the leading cause of blindness globally. And so it's our number one priority and disease priority. Now, it can exist in children. And often children in developing countries are much more likely to get cataract because of general ill health. Their mothers could come into contact with rubella or what we would have called German measles one day, or they may have vitamin A deficiencies and a range of other health issues. So they're more likely to have cataract in children in developing countries than in richer countries. But it's more often than not a case of older people. So if we all live long enough, we will probably get cataract. And if you live in a country with a good, strong health system, you book in, you get the surgery, it's all very straightforward and it's very easy. But if you live in a developing country, you either don't have access to the surgery, because if you live in a remote community, most of the surgeons are based in the capital cities where the big population bases are. And a lot of the time you don't know that that's something that can be fixed. We regularly hear from older people in different countries that they think that, you know, you get old, your hair goes grey, your eyes go white, and then that's the end. Whereas we know that we can give people meaningful life if we can help remove their cataract. So that's the leading cause of blindness, and it tends to happen younger in developing countries, again, because of poorer health overall than it does in more developed and richer countries. The leading cause of blindness in working age people, though, is diabetic retinopathy. So most people who have diabetes, if you don't control your blood sugar well, have regular tests, you will develop diabetic retinopathy. And the problem with diabetic retinopathy is if we don't catch it early and treat it early and you do go blind, that blindness is irreversible. But if we know about it, and if your eyes are treated with your diabetes and managed with your diabetes, then we can prevent blindness from diabetes. So it's really important for us to make sure people in developing countries know to have tests to ensure that if they have diabetes, they know they have diabetes, but also that they then understand if they have diabetes, that diabetic retinopathy is a major problem that they need to manage and that we need to manage. So that's the leading cause in working age adults. Then there's trachoma, which we've talked a little bit about earlier. It's probably one that many people might not have heard of. Trachoma is an infectious cause of blindness, and it's the world's leading infectious cause of blindness. And it's a chlamydial bacteria, so it's a bit like getting conjunctivitis or pink eye, as people might have known it. And what happens, though, is if you get repeated infections of this bacterial infection, it scars the inside of the eyelids. It turns the eyelids inwards, and it sees your eyelashes scratch on your eyes, and it's incredibly painful. And, you know, every time you blink, you get that scratching sensation, and eventually, if it's not treated, you go blind. And it's an awful and painful kind of experience for people. Trachoma really usually exists in poor countries where sanitation and access to water is a problem, because facial cleanliness and hand cleanliness, which we're all learning much more about with the COVID situation, is incredibly important. And if communities don't have access to water so that they can wash their hands, wash their faces, wash their clothing, then those bacteria can continue to spread. And it's a disease that women are most impacted by because it's spread by children. And in the countries where trachoma exists, mothers are the primary carers, and so it spreads from children to mothers, and so women are 4 times more likely to need the surgery that can reverse that eyelid, the inversion of the eyelids, and stop the scarring. And then the final major cause is uncorrected refractive error. So for those of you who need glasses, if your eyesight gets really bad and you don't have corrective glasses, you can be legally blind. And so that's a major problem as well. So having access to a simple, affordable pair of glasses is a really big issue that is happening around the world that we're trying to work with as well. So they're the 4 major causes of blindness that the Foundation works on.
I would love so much for you to kind of talk us through the communities, the people who get helped by the Fred Hollows Foundation, because, you know, a lot of the stuff that you've talked about is around awareness, is around training people, is around providing resources. So talk us through the different communities, 25 countries across the world. Amazing work. Let's go through that.
Yeah, so that's we work in an arc, basically because the foundation started in Australia, and then we kind of worked in a lot of the countries where Fred became involved. So places like Vietnam and Nepal, were really the early countries where the foundation became involved. And then he was also very passionate about Eritrea, which is northern part above Ethiopia, if people aren't as familiar with Eritrea. And so the foundation works in a sort of arc around the Indo-Pacific, I suppose you would call it, East Africa, through South Asia, Middle East, and then down through Southeast Asia and to Australia. And the reason we work in most of those countries, other than geographically, they're relevant to our part of the world, but it's where a lot of the blindness exists. And so we look to try and help people who are the most disadvantaged and are the poorest people who don't have access to services. So most of the work the foundation does is not in the capital cities. So, you know, we don't do a lot of work in Nairobi in Kenya or Addis Ababa in Ethiopia. We work in the remote communities, and we work closely with other eye health organisations. We're very strong on partnering other organisations. In Dubai at the moment, we're looking at partnership work with Noor Dubai, for example. But we are all about working with local partners to work in regions where there are no eye health services available. And so we train an army of community health workers, and they go out into the community and let people know about the services and encourage them to come along. And one of the wonderful things for me as a representative of the foundation, I'm fortunate to have been able to travel to a lot of the countries where we work, and you get to meet the individuals whose lives we're changing. So we've restored sight to more than 2.5 million people around the world, and that's such a huge number. But for me, it's about trying to think about every single individual whose life is changed. And you know, the first person I ever saw have their sight restored about 5 years ago was a little girl called Faith in a remote part of Kenya called Transmara. And she had been abandoned by her parents because they couldn't afford to care for her for a blind child. She'd been left with her auntie, Helen, and Helen was told by everyone in the community, the little girl was born blind, it's God's way, there's nothing that can be done. And she said, no, I don't believe that. So she picked up Faith and she put her on her back as a little 3-year-old and carried her for more than 25 kilometres over this rocky, uneven ground to get to the health clinic, which I was told when I went there, have a look at that little tin shed. And it was sort of like a little backyard garden shed that had been the eye clinic. And the Fred Hollows Foundation had taken that little backyard shed and built a not beautiful establishment, but a really impressive little community health centre and installed some equipment so that eyes could be tested there in the community. And so Faith turned up, and the eye worker who we'd trained said, she's got cataract, we can help this little girl, but we obviously can't help her here. We have to take her to the only hospital where they do paediatric surgery, ophthalmology on children, which was about 5.5 hours drive away. And so the Fred Hollows Foundation organised to take her to that eye hospital and have her sight restored. And the next morning when they took the patches off and she could see for the first time, I'm not afraid to say that I had a few tears in my eyes, so she could probably see better than I could at that stage. But this little girl looking around in wonder and seeing for the first time is something that will stay with me forever. And so it's those sorts of people who, she would have a life of blindness if it wasn't for the foundation, but for the people who support the work that we do, because everything we do is only made possible by people who are supporting the Fred Hollows Foundation.
This is the extraordinary thing, Alison. You've just given us one story, that it just makes you realize the impact of this. Forget the fact that this girl got her sight for the very first time, that it will change her life. But for other people around her who are seeing what's just happened, where people around her thought this was incurable, this was not treatable, you couldn't do anything about it, it suddenly gives an entire community hope. It suddenly brings all kinds of possibilities to this community, to others as well. The ripple effect is extraordinary.
That's absolutely right. And it's, as you say, not just her, but it means her aunt who had to stay at home and look after her. She had 5 other little boys of her own, and she couldn't go and work and earn money for the family. So the family was living on $1.50 a day that her father, the husband, was earning, and the mother couldn't go out and do the farming work because she had to look after a blind child. Well, now she can go back. That little girl can go to school, and that can help lift the family out of that cycle of poverty. And you talk about a whole community having an understanding. I also remember a lady called Francine, a 60-year-old woman in remote Rwanda. She had been widowed and so was blind, and so the community was taking turns in looking after her because, of course, you can't cook food over an open fire or go to your pit toilet over there if you can't actually see. And so the community had looked after her. And when we brought her back after having her bilateral cataract surgery, the entire community came out and started grabbing her face and holding her face in their hands and screaming, "It's a miracle, it's a miracle, look what God has done." And they were singing and dancing, and the joy is just unbelievable. But what it means is that everyone in that community knows that if they have an eye problem, we can help them. And the communities around get to hear. And so often people who have the surgery then become great ambassadors for eye care. And it's why, we often talk about the economic benefit of sight. And as the slide you've just put up shows, for every dollar invested in sight, there's a $4 economic return. And so the World Health Organization says that cataract surgery and eye surgery is one of the most cost-effective health interventions you can make, because it not only transforms the life of the person who is blind, but it just opens up opportunities enormously across the community.
Yeah, exactly. I mean, you're seeing kids go back to school. You're seeing parents able to care for their young children, able to work again. The elderly, of course, becoming more independent. So much happens here. But, we're going to break down how that works. How does it work that for every dollar that we invest, how do we see that return in the economy? But the numbers, just even from 2019 alone, are really just staggering. 646,000 plus eye operations and treatments performed, 20 plus million people treated with antibiotics for trachoma. More than 68,000 have been trained, including surgeons, nurses, community health workers, and teachers. 24 medical facilities built or renovated. This is mind-blowing. Plus 2.3 million plus school children and community members educated in eye health and sanitation. Your work isn't just go in, do the surgery, and that's it. There are so many aspects. It's very holistic. You're looking at all of the different ways that this community can benefit, their own eye health, but then that has, massive benefits for them in their overall health as well.
Absolutely. And, you talk about children, and one of the biggest problems when you go to a school, if you go to a school in the UAE, you'll probably find, 10% or 5% or whatever it might be of children wearing glasses. If you go to a school in remote Africa or Southeast Asia, none of the children are wearing glasses. It's not because they don't need glasses, it's because they've never had an eye test. And if you don't have good eyesight, then you can't read what's on the blackboard. You can't access education. And so children drop out of school because the teacher says, oh, well, Jimmy is not very good at school, so he should go away and not come to school anymore. And it's purely because he can't read. And so if you improve access to eye health at the school level, and if you get eye testing as part of the school curriculum, as we are advocating for and have successfully done in a number of countries, then it means more children have access to education. Obviously, education is the key to a lot of things in life. If you've got a good education, you've got a better chance of getting a job. And then, so we work on that level. We then work, and the photograph on that slide is of a garment factory in Bangladesh. We know that in a lot of countries where there is a big garment industry, that women are the primary workers. And it's an industry where you need good eyesight because there's a lot of fine detail with the sewing and the stitching. If you don't have good eyesight, you'll lose your job. if you don't have access to good eye care, you get more eye injuries at a factory. And so we've introduced programs working in those factories to give free eye tests to women, to train them in how to check their own eyes, and then if they need glasses, to give them free glasses. And it means that they then are able to continue to work and earn money for their family and lift their family out of poverty. And the added benefit, which is great for the factories, is that it actually increases productivity, which means they're more willing to then provide better health services to their workers. So there's a whole range of things, as you say. It's not just about surgeries, it's about the education, it's about making sure people are aware of all of the different issues and ensuring that everyone can access affordable eye care, because that means that the whole economy can be boosted and can really have a huge difference.
You can actually break the cycle of poverty just by focusing on this alone, can't you?
Absolutely. And one of the things we've found is that, you know, if you think about the Sustainable Development Goals and the fact that we're all committed to improving broader health, good eye health is actually a good indicator of good general health. And as you say, you know, if you look at things like trachoma, one of the things we do is provide mass administration of drugs to treat that trachoma. It's just a azithromycin antibiotic. That's actually reduced the rate of childhood mortality in some countries, because that, while it's there for trachoma, it actually improves general health as well. So there's a whole bunch of added benefits to what we do that actually improve the health of the communities. And you know, if you think about a time that we're in now with COVID-19, and you see that communities where there is stronger health systems are better able to tackle COVID-19. And so by strengthening the health systems of the countries where we work, we improve health all the time, which is hugely important in a global pandemic.
Let's talk about why, in fact, women are more likely to be affected by avoidable blindness. You know, talk to us a bit about this. I didn't realize that it was women, in fact, who were more affected.
Yeah, it's a really interesting one, because there's no biological reason that women should be more often blind than men. The only slight biological factor is that women live slightly longer than men, and as you get older, you're more likely to get cataract. So that's the only difference in reason. But about 55% of the world's blind are women. So we always say that it is a discriminatory disease, but it's usually 4 key reasons that are behind it. Access to education. So women are often poor educated, so they don't know about the fact that services are available. Their economic security and independence. So often women don't have control of the family finances. They have to rely on someone else to ensure they have good health services. Their social inclusion and participation. So again, relying on someone else to make sure that they get access to the services. And their psychological health, physical health and well-being are also impacted. So it's generally that, you know, women can't sometimes travel on their own to get services. So if their husband has to take a day off work, or their son has to take a day off work to get them to an eye doctor, then sometimes the family can't afford for the caretaker to take a day off work as well. And so they say, oh, well, mum's at home, she'll just have to stay blind longer. And so it's those kind of factors which play into why women are blind longer. And then there's really simple things, like we found a great example in Bangladesh by instituting a system where there are 2 lines, one for men and one for women. We ensure that there's equal access to surgery for women, because what often would happen in a crowded hospital or a crowded eye clinic is that the men are a bit pushier and they push to the front and they get served first. And if there's a time limit or the doctor runs out of time, it's the women who are more likely to be blind. So even though, or more likely to be neglected in services. So even though they're more likely to be blind, they're less likely to get surgery. And so it's really important for us to look at ways to improve access to surgery. And it's simple things like making sure there's breastfeeding areas available for working mothers to come with their children, making sure that women get seen as often as possible, making sure there are more women in the eye health workforce. All of these things can contribute to making sure that there are better services available.
That's so important. It's interesting. I mean, women are known for taking care of everyone else and leaving themselves last anyway, even when you have access to everything. So, this is even more vital in situations like this where women really do get left behind. And so, give us a bit more, Alison, about what the Fred Hollows Foundation is doing to close that gender gap in eye health as well.
Yeah. There's a range of different things that we're doing, and one of the things that we think is really important is not only having programs that specifically address women, but making sure that every program we do has gender elements in it, so what we call gender mainstreaming. So making sure that no matter what we do, we design a program when we think about that disparity. So making sure that both women and girls have equal or sometimes more access to services, because the only way you change that around is to make sure that women have more access. There's a great example of a project we're doing in Bangladesh, in a district called Barishal, where it's called Women Can, and we've empowered some local women entrepreneurs to run their own eye screening clinic at the local health service. And so women can go there and have their eye test done, get their glasses, right where they come for other services. And so little things like that can make a huge difference. So it's making sure it's in every project, but it's also about finding projects to target specific groups of women that are underserviced and underrepresented. For example, as we talked about before, the garment factories in Pakistan, there's a Bangle factory program that looks at helping women. And then there's projects where we've trained maternal and child health workers. So in a lot of countries, you have maternal health services delivered door to door. In Pakistan, they call them lady health workers, and they go around and see the new mums, and they offer pregnancy advice and those sorts of services. We've trained them in basic eye care so that when they go to the door, if there's a mum at home, they check her eyes, they check the eyes of the children, but they also check the eyes of the grandma or the grandpa who's in the house, who is less likely to be out working. Now, they can't perform cataract surgery, but if they find a problem, they can say, right, you can go to that health service there and they'll look after you, and they refer. So really innovative, but simple ways of finding to access people and to really find solutions that are targeted to specific communities and to their needs.
And very much looking at the local population and empowering them. This is one of the most beautiful and most important things about the foundation, that they don't fly in, fly out, and we've helped this community or whatever. They're empowering the community to be self-sustaining. These are self-sustaining solutions, long-term solutions. You train doctors, they train others. Awareness creates more awareness. So this is incredible work, and I love seeing all of this. Have to ask you about, of course, what has been going on in the world right now, and COVID-19 and the pandemic. How has that affected your work and the foundation's work?
It's probably changed our work forever, to be honest. The really interesting thing you might know is that eye health workers are actually some of the most impacted by COVID-19. The first doctor to discover COVID-19 in China was actually an ophthalmologist. And so obviously doctors who are looking at your eyes are getting close to someone's face. And so, if you're getting your ankle checked, you don't need to get as close to the doctor as if you're getting your eyes checked. And so it's been a real issue for us to make sure the most important thing for us is the safety of the health workers that we're working with, but also the patients who we're treating. So in some parts of the world, we had to pause our work. If, you can't have mass gatherings, so we can't bring mass eye camps together at the moment, for example. But what we've done is transferred some of our work to provide personal protective equipment to different eye health workers in the partner hospitals that we work in. And that's enabled them to both help with the immediate urgent response to COVID, but also then to start restarting our eye programs. So making sure when you get your eyes tested, you sit at something called a slit lamp, which is basically a thing where they look into your eyes. Well, in the past, you and the doctor were very close together looking into your eyes. So that's obviously not safe. So they've introduced screens that go between between you and the doctor. And when it first started, the doctors were using old x-rays and putting them in there as a makeshift measure, which is all very well, except you probably don't want to be looking through someone else's hip x-ray as you're getting your eyes tested. So we've helped supply the plastic screens to cover the slit lamps so that doctors can safely do those eye examinations again. We've transformed a lot of the areas where people come for services to make sure there's that social distancing, to provide masks, to make sure there's sanitising stations. All of these kind of things have happened. And so it means that probably from now on it's going to cost us a little more to deliver the services that we do, because we'll have to have these extra pieces of equipment and those kind of things. But we don't know exactly what the long-term implications will be. But it has just added some complexity to our work. And as I said, in some countries we're still paused on some of the work and only doing those emergency treatments where people need, diabetic retinopathy, urgent laser treatment, for example, or cataract surgery that is extremely urgent. And so we know that there'll be a greater backlog of people waiting for services when we can resume. The good thing is there's a lot of countries where we can start resuming. In Vietnam, for example, they've done a wonderful job at containing the COVID outbreak, and so we expect widespread programming to start again very soon. It's already started in a smaller scale, but we expect to be able to really ramp that up again soon. So there's been some disruption. There's been a change to the way we've had to deliver our services, but we've been very fortunate to have support both from our donors, but also from the Australian government, allowing us to use some of the funds that had been set aside for other things to be pivoted to help with this personal protective equipment for COVID.
Yeah, absolutely. We do have questions coming in. There is one question from MR coming in asking about here in the Middle East, because you guys established your office here in the Middle East in 2017. So talk us through your work here and the biggest challenges and issues that you're seeing.
Yeah, we're really very fortunate to have set up an office in Dubai in 2017. We've got 2 full-time staff members based in Dubai working on the region, but we obviously have country offices in a number of countries in the region. And one of the reasons we wanted to set up in Dubai is because we knew that was a really becoming an important global hub for health, and the International Humanitarian City there is a really important resource to be working with other organisations that are providing global health services. And so we set up in 2017. We're working in a range of countries throughout the region, but we're keen to also expand those opportunities. At the moment, we're working in places like Afghanistan and Palestine. We're working in Bangladesh, Pakistan, and a range of other countries in the region. There are about 15 million people in the region who are blind, and we know that global blindness is set to triple by 2050 unless we do more to ramp up our activities. And so we're really keen to partner with organisations in the UAE and across the region to look at how we can reduce the number of people who are avoidably blind. Diabetic retinopathy in particular is a real problem in the Middle East region, and one that we're doing a lot of work on finding new and innovative solutions for DR as well. So yeah, it's a really important region for us. We're relative newcomers, but we're really keen to partner with organisations, and we've already had some amazing support from the people of the UAE.
Absolutely. Now, I know that the work is global, it's across 25 countries. And I know a lot of people who are watching right now are thinking, I want to be part of this. I want to change people's lives. I want to make a difference. So I would love for you to take us through the different ways that individuals and businesses can help.
Yeah, there are a range of different ways, and on the next slide there's actually some great contact details for my colleagues who are based in our Dubai office, and they're very keen to have a conversation with anyone who would like to support the foundation's work. Nicola Lee is our head of philanthropy in the UAE, and she works to work with businesses and see if there's a way that we can work together to address both the the corporate social responsibilities that you might want as a business, but also meet the needs that we have as global eye health organisation. Individuals obviously can be regular donors to the foundation and supporters, and I think my wonderful colleague Maha would be very annoyed with me if I didn't mention that you can amplify our message. One of the things we really want to do as a foundation is you know, Australians tend to know who Fred Hollows is, but when you move outside Australia or expat Australians, they probably don't know as much about the Fred Hollows Foundation as we do, despite the fact that we're one of the biggest global eye health organisations in the world. And so anything you can do to tell people about our work, you know, follow us on all the usual social medias, share our website, all of those things are really important. So obviously financial support is you know, we're a charity, it's our number one thing, but there are a range of different ways that you could partner with us and raising awareness of the foundation's work and of the issue of eye health as well, because, you know, sometimes there are massive global health issues, and the pandemic is a great example. Those things are often seen as urgent, whereas sometimes people don't see eyesight as a really urgent priority, despite all of the things I've talked about today, which show that actually is a massive global problem and a global issue that we can really do something about. Yeah,
and the effect that it can have is incredible. Another question that's come in from Lisa asking, talking about the different regions that you guys cover, are there different regions that have more a different kind of impact, a different kind of cause for that you guys are trying to address? So in different places, what are you looking at as your biggest challenges right now?
Yeah, that's a great question. Every country is obviously different and at different stages of their development. So if you look at a country like Vietnam, which I've referenced a fair bit because it's sort of one of the heart and foundation parts where the foundation has worked. When we started there 27 years ago, there were fewer than 1,000 cataract surgeries done a year in Vietnam. There's now more than 250,000 surgeries done every year. We've trained more than 1,000 surgeons. And so that is in a very different position to some of the other countries which are much less advanced on the stage. So with Vietnam, we're focusing on things like education, eye health, those kinds of issues. If you look at most of Asia, myopia or short-sightedness is a massive problem, where children in particular need glasses at a much higher rate. And there's a view that a lot of that is to do with increasing screen usage and not getting outside and having access to, playing outside and using your eyes, distance vision and everything like that. And so there's a real wave of myopia in that region. As I said earlier, in the South Asia, Middle East region, diabetic retinopathy is an increasing problem as people's, diabetes used to be seen as a disease of wealth because, people who eat a bit too much or don't have a healthy lifestyle tended to be from richer countries. But as cultures have moved away from some traditional foods and have taken up some more of that, what we would call junk food, and don't have quite as healthy lifestyles as they used to, diabetes is becoming a real problem. And then in Africa, trachoma that I mentioned is a massive problem there. It's also a big problem in some of the areas of the Middle East, like Yemen, where there's been no one's been able to deliver services there because of the conflicts and things that have happened in countries like that. So yes, every country is a little bit different, and that's why one of the things the foundation does is we oversee everything from Australia. This is where our head office is and where we set the global strategy. But we have country offices that manage the programs for their own countries, and we work with local partners. And so, the person running the program in Kenya is a Kenyan person. The person running the program in Cambodia is a Cambodian person. And we really believe that making sure our programs are specific to the local context is really important.
You know what, Alison, like Fred said, this is our chance to show our humanity by taking care of one another. And right now at this time, I don't think we've ever needed it more than we do right now. So we are going to leave the details up right here for everyone so that they can get in touch. and have a chat about what you can do, how you can partner with the foundation, how you can carry on this vital work. And the best part, really, as you've been saying, is seeing the results, seeing the lives change, the families, the communities. It's all economies, entire economies can be changed by this. But Alison Hill, what an absolute pleasure it is to speak to you today. And we're so excited to see what's next from the Fred Hollows Foundation and to be part of that journey with you.
Thank you, Sally. And I just want to very quickly thank the Australian Business Group in Abu Dhabi and the Australian Business Council in Dubai for putting on today's event and for being such wonderful partners sharing the work of the foundation. As I said earlier, partnership is what we're all about. If we can't work together, we can't achieve anything on our own. So thank you so much. And if you would like to be in touch with one of my colleagues to talk about how you can support the work, we'd be eternally grateful. Thank you.
Yes, Maha is there, Nicola is there, the team is ready for all of it. And yes, once again, a big thank you to the Australian Business Group in Abu Dhabi and the Australian Business Council in Dubai for putting on the session. And to you watching right now, thank you so much for tuning in today, and we will see you soon.
Thank you.